Hello and welcome to today's webinar on MOBIDERM autofit garments, pre and post surgery for lipedema. While we're waiting for everyone to join the call, if you could answer the poll that's going to come up on your screen now as to whether you are treating lipedema, then that gives me an idea of how familiar everyone is with the condition. So do you treat lipedema? Select one of the following. Yes, I do. No, I don't. Or no, I don't know much about it at all. We'll leave the poll up there while we're waiting for other attendees to come in, maybe for a minute or so. Okay, so those statistics are starting to come in already. Thank you to those of you who've answered the poll. While we wait for another half minute or so, if you want to just have a look and see if you do treat lipedema, you don't, or you don't know much about it. All right, Anthony, perhaps if we stop the poll now. Okay, so those are good results have come in. So 75% of attendees say yes, they do treat lipedema, 8% say no, and 20% don't know much about the condition. So that's good. That just gives me a good idea of who's here and who's familiar with treatment protocols. Okay, so before we begin, I'd like to remind you all that today's webinar will be recorded, so you will be able to reference it again. I'll be taking questions and you can type those in the chat box at any time and I'll answer depending, possibly during this talk or at the end if it's more appropriate. I'd also like to direct you to our website, www.mobiderm.com.au, which has all of the product guides, excellent training videos, as well as information on further training and case studies. My name is Lisa Higgins, and I'm a VODA-trained remedial massage therapist working in private practice on the northern beaches of Sydney. I originally trained in lymphatic drainage in 2006 at the Nature Care College here in Sydney, and then I retrained in the VODA technique in 2013. When I was doing my clinic hours in 2006 at Nature Care, I was introduced to a patient with lipedema. So I've had an early introduction in my lymphatic career, and it piqued an interest for me right from the start of how do we treat these patients for whom nothing seems to work. In my practice, I see a mix of clients with mild to moderate primary and secondary lymphedema and a growing number of women with lipedema. Most of these lippy ladies are in maintenance mode, but more and more are looking at surgical solutions for their condition. As this is still a fairly new procedure in Australia, there is a lot of scope for trying different compression approaches in the pre and post-surgery phase. And that's what my talk is about today. I'd like to take this opportunity to give you a quick introduction to the companies that are offering this webinar today. Medical Rehab was established in Victoria, Australia in 2010. It is the sole distributor for the MOBIDERM range in Australia and is committed to providing therapists and patients with not only high quality product solutions, but also with ongoing support and education. Medical Rehab also stocks rehabilitation products, knee scooters, body supports, and more. In 2019, they appointed 6 therapists in different states to run their workshops and act as clinical consultants, acting as a point of contact with therapists needing a little more information after the workshops. Tuan is a French company that was founded in 1847 and is the manufacturer of the MOBIDERM and Venaflex range. Every product is designed in close collaboration with those involved in the medical treatment of the patient and Tuan. Tuan creates and distributes medical devices that enable patients and consumers to become active players in their own health. Medical Rehab is proud to be the sole supplier of Tuan's lymphology range in Australia. So how does MOBIDERM work? I'm not going to go into a big discussion around the structure of the MOBIDERM system, and I'd know that you would all have come across that before. This is just a slide to show you this sort of how putting the MOBIDERM on top of the skin activates the initial lymphatics. So this is some skin here. This is the layer where the lymphatics are, layer of muscle underneath, and a layer of MOBIDERM that's put on top of the skin. And the green arrows show the different pressure that's coming from muscle activation and from the compression on top of the skin. And this creates a shear that it activates the initial lymphatic vessels, increasing uptake of fluid into the lymphatics. What is MOBIDERM? So just to remind you that MOBIDERM is an adhesive non-woven fabric and an open cell foam. This lumpy bumpy material, as I like to call it when I'm talking to my clients, creates a pressure variance which activates the initial lymphatic vessels. MOBIDERM comes in 2 different sizes, a 15 by 15 millimeter square and a 5 by 5 millimeter square. You can see how they can be applied in different areas. The 5 by 5 millimeter square is used for smaller areas like the hands, feet, fingers, or as swell spots for breast or even neck edema. And when I'm making a swell spot, I cut either the 15 or the 5 millimeter into the size that's required for the area, and I insert it into a cotton stockingette so that it's a softer pouch and it can be inserted wherever it's needed. The 15 by 15 millimeter squares are used on larger areas, on the arms, legs, or abdomen. And on the abdomen, it can just be placed underneath compression pants, exercise pants, or just underwear if that has enough compression. It's effective, practical, and comfortable. There are some contraindications to using MOBIDERM, and they're just common sense ones that you know already. Skin inflammation infections, you're not going to treat an active cellulitis. Very fragile skin. and anything where there can be a breakage, delicate skin, you want to be very careful around treating that. Make sure that you have a lining underneath the skin so that it reduces the effect of any irritation. I'm showing you the 4 components of the bandaging system quickly, just to help you understand how the garments came into being. The 4 components are the cotton under bandage. This is a really soft, delicate material, and it can be used either as a single layer stockingette, or you can wrap it around the limb. So it depends on the size of the limb. If it's a very large limb, you might want to just unravel the roll and wrap it like you would a normal bandaging. If it's a very normal size and shaped limb, you can just use it as a stockingette. Next comes the MOBIDERM layer, then the short stretch, FlexiDeal, which is used to reduce the bulk of the MOBIDERM, bring it down to a more manageable size, and which is left on overnight. And then lastly, the BiFlex layer, a short stretch bandage with very convenient markings to help you get the right compression. And that BiFlex layer is taken off overnight as you need less compression while you're asleep. So how does the MOBIDERM system work? It works by stimulating the lymphatic vessels to remove lymphatic load. It reduces rebound by activating the initial lymphatic vessels, reduces filtration, and softens fibrosis. And it is very easy to use, highly adaptable. It enables a faster reduction. It's easy for the patient to move. It's much lighter than conventional bandaging systems. It's reusable. Less is more effect, so we have fewer layers and we can remove a layer as needed. It gives better patient autonomy and it's cost effective. So here's a range of made-to-measure MOBIDERM options. So these come in varying sizes, obviously made for the actual person that it's needed. It can come in the arm sleeve without a hand as a gauntlet or as a mitten, and in the sock or the thigh, the full stocking. They can be used as a daytime alternative for patients with diabetic neuropathy, in palliative care, aged care, or with patients who just generally struggle getting elastic compression on during the day. All the made-to-measure garments are manufactured in France with the latest computerized technology. And turnaround time is about 10 working days, so a couple of weeks between the time you order and the time it gets to you. There are guides on the website, so if you want to take measurements, there are guides already on the website. Download one of those. And if you can, add a photograph of your patient. It just gives for a better result if they can see the actual shape of the limb that's being prepared for. These can be made with Velcro or zips or whatever you need to make it easier for your patient to get those on independently. And here's the AutoFit range, the arm, the sock, and the stocking. So it's still the best scenario would be to wear your daytime compression garment, so your elastic compression garment, and the MOBIDERM at night. So the AutoFit range, generally it's made up of 2 components. In the main arm or leg part, you have the 15 by 15 millimeter squares with the 5 by 5 millimeter squares in the hand or the foot segment. Over the top is a slightly stretchy material to add a little extra light compression. The garments are fastened with Velcro, making them easy to don and doff, and making them easy to adjust during the day if the limb reduces and it becomes a little too loose, it's very easy to then tighten them up. It makes them a good option for limbs that are going to be reduced surgically because they can be reduced over time. If you look at the arm sleeve in more detail, you can see that there are Velcro tabs on the outside. These make it very easy. You can adjust them to get the right fit. And a really interesting option is that if you need to use your hand and don't want to get the garment wet or dirty, you can undo the first tab and roll the hand segment up while you're working with your hands. And then once you're done, you can replace the hand section. So the next would be the AutoFit sock. This is a good option for those with lower leg lymphedema or lipedema. As you can see, there are Velcro tabs on either side of the garment, and they are very easy to get on and adjust. And there are really good videos on the website showing how to put these garments on effectively so that you get the best outcome. They also have non-slip stickers on the bottom, like you do in the hospital socks that you get, so that if you get up in the middle of the night, then it is you're not going to slip and fall when you're half asleep. Then there's the AutoFit stocking coming all the way up the leg. This is just an extended version of the sock, and this is the garment that I would recommend for those who are having lipedema surgery. Even if they're just starting with the lower limb, more than likely they'll be having the upper limb done at some stage. So to save on cost, just have the same garment and you can reuse it for multiple surgeries. Again, it's easily adjustable and very easy to don and off. Okay, so the ways I use the AutoFit garments in my clinic. So I use it in a number of ways. I encourage that people wear their elastic garments during the day and the AutoFit at night. I also have non-compliant clients who I'll talk about a little more, how I get them to wear it. And I use it with clients who would actually benefit from intensive bandaging, but for various reasons won't commit to that treatment. And a new focus for me is looking at the pre and post lipedema surgery clients that I'm seeing. I don't bandage in my clinic, mainly because I'm a massage therapist and clients can't get a Medicare rebate for my services. So it gets expensive to come in daily for a bandaging protocol. I'm also lucky in that my clinic is close to Mount Wilga Hospital. So if I have a client who would really benefit from a round of bandaging, I refer them there so that their entire treatment is covered by their health funds. Then they come back to me for their maintenance treatment. I do use the bandaging system within treatment time, starting by bandaging a limb and then doing my MLD, removing the bandaging and clearing the area, as this starts to soften areas of fibrosis very quickly and gives a better result in a short time. But I have a relatively large non-compliant client base. They don't like wearing the elastic compression for a number of reasons. It's too hard. It's uncomfortable. I don't want people to ask what's wrong with my arm or my leg. You know what I mean. You've heard it. So I let them have their say and ask, what if there was something you could wear while you sleep? Oh no, I get too hot at night. Couldn't possibly. Okay, then how about when you get home from work until you go to sleep? Generally, there's a pause because there's no actual comeback. I'm giving options. I'm a negotiator. And to me, wearing the AutoFit is infinitely better than no compression at all. And if I can get my clients wearing it at least for 4 or 5 hours a day, I know it's doing them good. So I have a lot of my clients using the garments, either as a standalone or as part of their 24-hour compression routine. So I'm just going to touch on this briefly. It's a bit of research, and this is on the MOBIDERM website, and you can go and have a closer look at it. It's the Maryland Research Project, and I thought I'd mention it briefly here, mainly to show the compliance rates, but also how effective the AutoFit garments are at maintaining gains post-bandaging. So this research was done with a cohort of breast cancer-related lymphedema patients post their intensive bandaging period. So all 40 of the patients received the same bandaging for the same length of time. And then the research started after that, where group 1, which had 20 participants, were given a daytime sleeve and an AutoFit garment to wear overnight. Group 2, also 20 people, were just given a daytime sleeve, which they took off and slept with no compression overnight. At day 30, both groups were measured, and group 1 had maintained their reduction after their bandaging, but group 2 had a rebound effect. At that stage, group 2 were given an AutoFit garment to add to their routine to wear at night. So all 40 in the cohort were having daytime and nighttime compression. And at day 30, when they were measured again, group 1 had maintained the reductions they had gained during their bandaging, and group 2, the rebound effect had slowed. What it also showed was the high compliance rate. So 90% of the patients wore the garment every single night, and 10% wore the garment 4 to 6 days per week. Personally, I think that's almost full time, and I think that's a really high compliance rate, proving that it's just really comfortable and that people also found it beneficial as part of their routine. Okay, so a little bit about lipedema. So what is lipedema? That information is changing all the time. What we're finding is that lipedema is a collection of diseased fat cells, too many cells that continue to grow, and there's high inflammation throughout the whole body and around those cells. The latest research is also saying that perhaps it's a connective tissue disorder. Each fat cell is surrounded by a matrix of connective tissue, and the intracellular fluid is also higher in fluid, in fiber, in connective tissue than normal. This is new, and that there's information coming out about that. I find that a really interesting component because it means there's a lot of fibrosis that we didn't necessarily know about before. So the condition is generally non-responsive to diet or exercise, or it's minimally responsive, and the weight that is lost is usually non-lipedema fat. In the early stages, there's no lymphatic involvement, though obviously it can develop into lipolymphedema, which then puts the patient at risk of infection and fibrosis, or more fibrosis, in the same way as a lymphedema patient. There's painful areas, generally at the fat pads and along the inner thighs, but it can be anywhere. Lots of bruising, cuffed ankles or wrists, and lots of mobility issues, and there are often multiple comorbidities. Generally, in the treatment is the compression aspect would be custom-made class 2 flat knit waist high stockings. And there's a high non-compliance with these, mainly because these women have high degrees of pain, and going from no compression directly into class 2 flat knit can be a little bit of a struggle. So there's high non-compliance. They just either choose to wear no compression at all, or they start with something softer, whether it's sports compression or various other things like that. Now, what I have found is let's come here. Okay, so the current protocol, now I've spoken with only one of the surgeons working with lipedema surgery, the specialized liposuction. And so I'm going off of his protocol. And I've had a chat with him recently, and he's going to be looking at the AutoFit garments as part of his protocol. He was really impressed to see the amount of work that went into developing the garments. So he recommends, like all the other surgeons, that for a period of time before the surgery, sort of as long as possible, so 3 months if possible, 6 weeks minimum, that clients are wearing their custom-made class 2 flat knit garments. They're doing daily pumping. They have an exercise regime and a low inflammation diet regime. Their post-surgical stockings are applied in the OR. What he finds is these have minimal compression and the feet are not covered, which can lead to the feet swelling post-surgically, even if the feet weren't involved beforehand. And then patients are encouraged to get back into their class 2 flat knits as soon as possible. And of course, then they'll need to be measured for a new set of class 2 flat knits as the leg subsides. Obviously, it's going to be a different shape, a different size, and things aren't going to fit very well or be as effective as before. So I had to think about this and remembered way back to the first ALA conference that I went to, which was in Auckland, I think in 2014. And I had listened to a talk given by Alex Munnock, who's a surgeon, and he was referencing actually a talk given by Helen Mackey earlier in the day. And he was commenting on how amazing the liposuction results for lymphedema patients at that stage that Helen Mackey was involved in. He found those results when they looked at the canisters of fat. There was much less fluid in them because of the amazing bandaging protocol that had happened at Mount Wilga Hospital pre-surgery. And he was saying that they had, in Scotland, in his surgeries, they had much more of a fluid component in what they had removed. And I kept that in mind that, okay, so pre-surgery, if we can reduce the amount of fluid in the leg or arm as much as possible, then you're going to have a much better result at extracting the fat, which means you'll be able to extract more fat. And I stuck that at the back of my head all of this time and thought, interesting. Now, again, I don't bandage, so I don't do that with my clients. And I thought, well, what's going to be the next best thing? And for me, that is using the AutoFit garments. It's going to be the next best thing. It's got the clients working and wearing it on a regular basis. It's reducing fibrosis. It's softening some of that fibrosis, which means that it is easier to pull the fat out. The garments can actually be used in conjunction with other things. So the daily pumping, if you put a garment on underneath it, that's going to make the pumping more effective. The two can work together, or you can use a roll of MOBIDERM, wrap that around the leg or arm, and put the pump over it. And that, because of the lumpy bumpy stuff that's creating the pressure variance, that's going to give a really good result, and it's going to work deeper into the fibrosis, and then the rhythmic pumping is going to clear it away more effectively. So the two can work really well together to create a better result. Okay, so why use the AutoFit? So again, we have it's a fat disease and a connective tissue disease with a layer of connective tissue, increased inflammatory receptors, which means increased fibrosis. So the AutoFit works to reduce the areas of fibrosis. So this is just exactly what I've said in the previous slide. And again, we recommend you wear the pre-surgery elastic compression during the day, or whatever compression they're wearing, because there are still some clients who can't get up to the class 2 flat knits, and they may be still only wearing exercise compression, or they may be wearing the BioFlect, whatever it is they're working. So they wear that during the day and wear the AutoFit at night, so that they have 24-hour compression happening. This is going to improve the lymphatic capability, reduce the fluid component, can be used under the pumps, and it's recommended that they wear the garments consistently at least 6 weeks prior to surgery and as part of their recovery for as long as necessary. Apologize for the phone going off. I thought that was on silent. The adjustable fit means that it's a cost benefit. They're not needing to instantly go out and get a new garment made, because they can reduce the size of the AutoFit as needed. And a little tip here would be, is if they've had a massive reduction and the leg has come down significantly and the garment seems too big, you can add a layer of the BioFlex over it. So you can put your extra compression over the top to add a bit more compression, so that you don't need to change the garment. So post-liposuction, the garment is easy to apply. It is comfortable post-surgery, and it can either go over the surgical garment that the surgeons are already using and put you in the OR, or you can put a cotton lining underneath. And I really would recommend that there is something against the skin before putting the garment on, because the skin will be a little more tender having just been operated on, so we want to protect the skin. They can be put on in the OR post-surgery once the surgical staff are familiar with it. Obviously easily adjustable with the Velcro tabs, and the feet and hands are included in the compression, which the surgeon I spoke with was really pleased about. And the garments can continue to be used as part of regular maintenance after the surgery and recovery period, making it a cost-effective option. Okay, so I apologize. This is not a very clear slide, and you don't really need to have a big look at it. What I am putting it up there for is to show that even though there has not been research done on the AutoFit garments and pre and post liposuction surgery, there has been a poster done by Nanny McMullen, and all the details of the authors are on the next slide. And if you want more details, you can get in touch with them directly. It was presented at the 2018 ALA conference in Brisbane. And Nanny's poster gives a very clear indication on how MOBIDERM can be used as part of the surgical process. So here's a little bit about what they did. They had a patient with stage 3 to 4 lipolymphodema with various comorbidities. And her goal, she wanted liposuction and debulking so that she could walk better and reduce the possibility of being in a wheelchair later on. So they used a range of garments. 6 weeks pre-op, she had a custom fit MOBIDERM garment made. 1 week pre-op, she was wearing that garment 24 hours a day with the Biflex 16 plus bandage on top to further reduce the lymphedema aspect as much as possible before the surgery. And then post-op, the garment was put on in theatre, but no Biflex was added until her pain levels had come down and she could tolerate it. In the next 2 weeks, the Biflex was added, and she did that 24/7. And overall, there was a range of garments used. So she had the MOBIDERM system, she wore BioFlex, custom fit MOBIDERM garments, and custom fit Lipoedema garments. And for 6 months post-surgery, she wore the MOBIDERM at night. So if you'd like more information on that, then I would say that you can contact the authors, Nanny McMullen, Mr. Ramin Cheyenne, Nola Young, and Sarah LeBook. And you can find the therapists on the ALA Find a Practitioner function for more information. All right, so any questions? Is there anybody who has comments about things that you've worked with the MOBIDERM, perhaps in this kind of area, working in pre and post surgery or using the garments for non-compliant patients? Is there anything you'd like to ask that I can give a bit more information on? All right, there are no questions coming through. Okay, so the rough pricing, excellent question. Let me get my list out for you so I can give you accurate. And that's a very good question. So the sleeve is 230. The AutoFit sock is 275. And the thigh-high stocking is 325. Now, one of the things that I can recommend, some surgeons will do one leg at a time. So they only need to buy one garment and they can obviously use it for each leg. Another option, if you're looking at reducing the cost impact, certainly in the early stages, is that they can buy one leg and alternate. So one night have it on one leg, one night have it on the other. Now that's not ideal, obviously, but if somebody's umming and ahhing whether they want to invest in this, it's a good way, and it does work really well and still brings a very big reduction to the leg or arm, depending. Are there any other questions? What I could add is that the garments, the leg garments, come in 4 different sizes and 4 different lengths. So there's quite a range to choose from. And I've had the situation where I have had a client, a lipolymphedema client. She wasn't going to be having surgery, but she had had bandaging in prior years and just had too many comorbidities, too many other medical appointments, and couldn't commit to doing bandaging again. But her leg was slightly outside the range of the largest garment. She could still get it on, but it was not quite a perfect fit. But we had a really good solution. So while she couldn't bandage her whole leg due to mobility issues, she could bandage the top. So what we did was she bought one garment, and I suggested the wearing it on one leg at a time, obviously. What she did was she had some bandages at home, and the first night she bandaged over the thigh, and then the second night she put it on the other leg, bandaged over the thigh. And when she came in to see me a week later, because the Velcro tabs couldn't do up beforehand, a week later she came in with her garment on over her track pants, done up. So in 1 week, she was able to reduce the thigh significantly to where she could just use the Velcro. And in the end, she ended up getting a second garment so that she could have them on both legs at the same time. So there are ways, it's about being flexible and looking at ways to make the garment work for you. Now, there is a question on the gradient of the MOBIDERM AutoFit, the pressure gradient. I'm going to leave that question because I can't answer it, and maybe we can get back to you on that, or if I could have that message put into my chat box so that I can pass that on, Anthony. Good question. So it's 15 to 18 milligrams of mercury. So it's not a high compression, but it's a good working compression. And that allows the MOBIDERM squares to just not be complete, well, technical term here, completely smushed into the skin. It means that those squares get to move. Yes, so the next question is, have I had so much reduction that the Velcro meets? Yes, how have I managed to this? I have had it. So with this client, she actually did it herself. So she bandaged, literally she only bandaged one night each leg. And that was enough to bring the garment down so that the Velcro tabs could do up. So the next question is, would patients who have liposuction surgery have recurring of the initial symptoms, or would it be a permanent fix? Unfortunately, I don't think it's a permanent fix. You can find out more about that. You know, there's some excellent talks by various practitioners talking about surgery. I don't think that the evidence is there that it's a permanent fix. You know, there is a possibility that it can come back if it's not taken off completely at the time, or it may come back into other areas. That's not my actual, you know, because I'm not involved in that aspect, but we do see that sometimes it takes multiple surgeries. And some surgeons, the next question is, does the surgery consist of just liposuction, or are other things performed? The surgeon that I have dealt with just does liposuction. There are other surgeons who will do liposuction as well as skin removal, depending on the size of the client and their needs. And, you know, the treatment will obviously be a little bit different if there's been a skin removal, but as you saw with the slide of Nani's research, they got her back into the MOBIDERM garment pretty quickly after surgery. And the next question is, how long does the client need to continue using the garment post-surgery? I would say at least 6 weeks, because by then you've got a good post-surgical reduction. But I'd encourage them to continue wearing them just at night for a few months, just to really maximize and continue to bring that leg down or arm. So the next question, what are your thoughts on using silver sock liners under the AutoFit garment? What about the cotton over the garment to protect the Velcro? Yeah, so, you know, it's the silver sock liners I haven't used. I don't see that there would be a problem with that. You know, the garment can be used over a thin layer. So, you know, if somebody's using it at nighttime to sleep in and they've got their thin cotton pajamas, I'd say put it over the garment. So it's still going to work really well. And yeah, the cotton garment over the cotton lining over the garment to protect the Velcro, sure. Or even, you know, you could even try something like a bit of chubby grip if it needed a little bit more, but the cotton garment is a really good option to use as well. The next question is, suitable for someone who is bedridden? Absolutely. Really good for people who are bedridden. It's designed to be worn while you're asleep. So for somebody who is bedridden, it is a really good option. Also because it's easy to get on and off. it's going to be easy for their carers, or much easier for their carers to use than conventional bandaging system, or elastic stockings, which can be pretty difficult to get on with somebody who's bedridden. So I'd definitely be using those. Really good option. All right, I'm just checking through to see if there's anything that I've missed. Okay, so the next question says, have you had so much reduction that the Velcro meets? How have I managed this? Okay, I personally haven't experienced that, but I guess if that happens, one of two things, you may have to go down a size if that's possible, but also that's where you can do the bandaging on top. So a bit of bandaging, the cotton bandage over the top, or tubey grip, something like that, to just give it a little bit more compression so that it's still able to be used. All right, so there are no more questions at the moment. So if there are no more, then we can probably look at ending up here. And if any more questions come up, then please feel free to contact us through the website. Go and look at the website. It's got really excellent videos on there, and you can get a lot of information on how the system works. And the research on there is really good, and the case studies are very interesting to read as well. So if there are no more questions, thank you so much for your feedback. It's really useful to have that, and very good to be able to answer questions in real time. And I'd like to thank you for your time. All right. Oh, okay. Oh, so there's one more that's come through asking for more clarification. She means a Velcro overlap, that the leg is too small. But I understand that. So if the Velcro overlaps and the garment's too small, then you look at a smaller garment if it's available, or you just, I don't know what else to say. You add another layer of compression over the top so that you can still get more of a reduction. How many days can you leave MOBIDERM on in a reduction phase? You can use it daily. I would be getting the garment off every day, obviously, for showering purposes, and to check that the integrity of the skin, that there's no cuts or sores or anything happening, because that can happen with people, and it's just always good to check the integrity of the skin. But like with any reduction phase, it can be left on 24 hours. You take it off, have a shower, and put it back on. You would want to be able to wash it somewhere in between that. But it's used in exactly the same way as your garments, as your bandaging would be. So the next question, what other options are available after 6 months of MOBIDERM use post-surgery, as I've heard that efficacy would be significantly reduced? So, MOBIDERM, I would use it as part of the ongoing treatment. So it's not necessarily just as a reduction tool. It can just be part of somebody's maintenance phase, or if they don't want to be wearing 24-hour compression, they still have their garments, and if they have a flare-up, if they have a hot day and their limb swells, they can add it as part of their reduction protocol in that case, just as part of their regular routine. They don't necessarily have to wear the MOBIDERM all the time for the rest of their lives. It can just be part of their toolbox. Do you use skin moisturizer before applying the AutoFit garment? I think it is very, very important to use moisturizer at all times, just because, as you know, the integrity of the skin is really important, and you don't want dry bits happening. You want your skin to be well moisturized, and obviously, like you would with elastic stuff, you put it on, let it dry before putting the garment on. Okay, so a question is, but bandaging is left on for 2 to 3 days in a row. So if you use MOBIDERM system, patient has to return daily to therapist. Okay, good question. So there are different bandaging systems. So not all of them are 2 to 3 days that you leave them on. Those then you dispose of. The MOBIDERM system is a daily bandaging system. It's not left on for 2 or 3 days at a time. In the traditional 4-layer bandaging systems that we are taught as therapists, that's daily. You know, you come in, you have your MLD, your exercise, anything like that. You put the bandaging on, you go away, you come back the next day and repeat the process. So it's not left on for days at a time. It is a 24-hour type thing. You change it every day. As a next question, as a clinician, after a massage, would you moisturize the limb before donning the garment for the client? Only if the leg or arm is very, very dry. So I do have some moisturizers here, and yes, sometimes I do, but not as a regular thing, because generally the client has had a shower and done their own moisturization before coming in. If it's necessary, absolutely. Just because I feel really concerned about putting a garment on to skin that is not moisturized. All right, any other questions? And if anyone wants more clarification, just get in touch and we'll try and give you more information. All righty, so there are no more questions coming through, so we can end the presentation here. Thanks for attending, and we'll see you at the next one.